In this video, we'll learn about a mechanism called as baroreceptor resetting. Baroreceptors are stretch sensitive receptors which are located in the carotid sinus and the aortic arch. Carotid sinus is nothing but the beginning of an internal carotid artery where it is an expanded, okay? So the common carotid artery divides it into internal and external carotid artery. At the beginning of internal carotid artery, there is an expansion which is called as carotid sinus, and baroreceptors are mainly located in this carotid sinus, and another site is your aortic arch. These are stretch sensitive mechanoreceptors, and when I tell they respond to increase in blood pressure, when I tell blood pressure, it specifically responds to mainly mean arterial pressure, not diastolic or systolic blood pressure. Okay, they mainly respond to what is called mean arterial pressure. So mean arterial pressure is nothing but an effective perfusion pressure to various organs. It is calculated using the formula diastolic blood pressure plus 1/3 of pulse pressure. So pulse pressure is nothing but systolic minus diastolic blood pressure. So mean arterial pressure is nothing but diastolic blood pressure plus 1/3 of systolic minus diastolic blood pressure. Now let us take a normal person and calculate what is the mean arterial pressure. So normal average blood pressure will consider as 120 by 80 millimeters of mercury. 120 is systolic, 80 is diastolic blood pressure. So when you apply the previous formula which I explained, mean arterial pressure is equal to diastolic pressure plus 1/3 of systolic minus diastolic blood pressure. It comes to around 93 millimeters of mercury. So in a normal person, the mean arterial pressure is 93 millimeters of mercury. So, when in response to rising mean arterial pressure, remember baroreceptor will send signals to nucleus tractus solitarius via cranial nerve, 9th and 10th cranial nerve, which is present in the from the baroreceptors till the brainstem. The NTS is present in the brainstem. So this is the normal mean arterial blood pressure 93, which your baroreceptor is responding. So in case of a chronic hypertension, let us take an example. If the blood pressure is 160 by 90 millimeters of mercury. So mean arterial pressure, if you calculate using the formula, it comes to around 113 millimeters of mercury. So in a normal person, the baroreceptors mainly sense if the blood pressure goes above 93 millimeters of mercury. So in a chronic hypertensive patient, just understand now what had happened is the baroreceptors will start responding to blood pressure above this new value now. Above 113 millimeters of mercury only the baroreceptors will start responding. It means in a chronic hypertensive patient, what has happened is the baroreceptor is continuously exposed to a very high blood pressure. So now the baroreceptor will start thinking like this is a new normal value. So it will start responding once the mean arterial pressure goes above 113. It will try to bring back the blood pressure back to this normal value. If the patient, chronic hypertensive patient start exercising, what happens? The baroreceptors, the blood pressure will increase, right? It goes to 170, 180 like that. So in him, it will think like 160 by 90 is normal. So it will try to bring back the blood pressure back to 160 by 90. So this mechanism is what is known as baroreceptor resetting. So instead of responding to 93 millimeters of mercury, it will respond to a new higher level. Clear? So that process is called baroreceptor resetting. It is a physiological adaptation where baroreceptor adjusts their sensitivity or a threshold to operate at a new baseline blood pressure value. So instead of responding to a initial normal mean arterial pressure of 93, now it will set at a new baseline. It depends on how long the patient's blood pressure is higher, meaning it depends on the duration of hypertension. So you can see here on the x-axis in this graph, it is represented by mean arterial pressure. On y-axis, we have receptor firing or the sensitivity of the receptors. So when the BP is increasing from 0 to 100, you can observe somewhere very close to 93 millimeters of mercury, it has a maximum sensitivity, meaning above that if the blood pressure goes, the baroreceptors start firing maximally. Clear? So can you see here almost around 70% of firing is seen here. But in a chronic hypertensive patient, just observe the sensitivity has increased above 100, somewhere very close to 110 or 113. There is a maximal sensitivity in a chronic hypertension. So this process of resetting is what is called as, or increased sensitivity is what is called as baroreceptor resetting. There are two types, acute resetting and chronic resetting. Acute resetting occurs within minutes to hours, usually seen in case of exercise or some emotional stress. Remember, it is temporary and it is reversible. But chronic resetting occurs over days to weeks or months together. It is seen in patients with a chronic hypertension or a sustained hypertension. Baroreceptor So what causes this baroreceptor resetting? Okay, or the mechanism for baroreceptor resetting? It occurs at three levels. One is baroreceptor level. The other one can be at the center, that is your nucleus tractus solitarius, or sometimes hormonal influence is also there for this baroreceptor resetting. These are the three hypotheses. Okay, so at the receptor level, remember, chronic blood pressure causes sustained stretch that will lead to remodeling of the arterial wall and sensory nerve ending. So the carotid sinus itself will undergo now structural changes in the vessel wall that will reduce the baroreceptor sensitivity. Yeah, and also the same time you can observe the nerve endings adapt. They require more stretch to activate the same firing. And also the amount of neurotransmitter released also will be altered. So the nerve endings itself are undergoing adaptation. That is mainly the ninth and 10th cranial nerve, the glossopharyngeal nerve and the vagus nerve. And also there is a change in the ion channels. There is a ion channel modulation that is involved in detecting the stretch are down regulated. So the ion channels are reduced, meaning if there is a maximum stretch, then only these ion channels will open or respond. So this alters the action potential threshold and frequency of firing. So the changes what you see at the receptor level, that is at the what do you call that, the carotid sinus level, is the structural wall changes happen. At the same time, there is altered expression of ion channels. So the amount of afferent discharge going from the receptors are reduced. So at the nucleus tractus solitarius level, that is at the brain stem, what has happened is there is neuroplasticity in the NTS. So there is decreased responsiveness of these second order neurons. So the neurons in the NTS will show reduced response. At the same time, there is a reduced synaptic neurotransmission. That is nothing but the amount of neurotransmitters released from baroreceptors to the second order neurons is reduced. And also there is enhanced sympathetic tone. That is the central integration shifts to favor higher sympathetic outflow. Meaning initially imagine there was only 20% of sympathetic outflow. In a chronic hypertensive patient, there will be like 40% of increased sympathetic outflow. That is like, if always favors a higher sympathetic outflow in chronic hypertensive patients, even if the baroreceptor signals keep persisting or keeps coming from the baroreceptors, now the sympathetic outflow will keep on increasing. And also remember, there is some hormonal influences which also plays a role in baroreceptor resetting. That is, there's a chronic elevation of angiotensin 2, aldosterone levels. All this will lead to of altered baroreceptor sensitivity. It also, this increase in these two hormones also promotes sympathetic activation, and because of oxidative stress, there is altered gene expression in the baroreflex pathways. So what happens is, in chronic hypertension, remember, the baroreflex pathway becomes less responsive. It not because it fails, but because it resets to operate at a newer level. That is called a new normal. That's why remember, early management of very high blood pressure is very important to prevent this maladaptive physiological adaptation of baroreceptor. So just to summarize this here, the baroreceptors present in carotid sinus and aortic arch, because in chronic hypertensive patients, what happens is there's a persistent stretch of arterial walls. This will lead to decreased baroreceptor firing sensitivity. So there is a change, structural change which happens at the receptor level, and the amount of neurotransmitter released or the afferent input to brainstem, the nucleus tractus solitarius, also reduced. At the same time, there is increase in sympathetic tone at the level of brainstem. All these mechanisms will lead to increased blood pressure, that is leading to chronic hypertension. So there's a new set point at which your baroreceptors are working now. So that is called as baroreceptor resetting. If you want to put that into a flowchart manner here, chronic high blood pressure leads to persistent stretch of arterial walls. This will lead to reduced baroreceptor firing sensitivity because of the structural changes which happen. That leads to decreased afferent input to brainstem, to the nucleus tractus solitarius. So at the NTS level, because of neuroplasticity, there are some changes which are noted in the NTS. And also there is increased sympathetic tone that leading to increased blood pressure, high blood pressure. So the baroreceptors now respond to a new normal level, that is your reset baroreceptors, nothing but otherwise called as baroreceptor. The whole physiological adaptation which takes place in a chronic hypertensive patient is called as baroreceptor resetting. So always remember, that's why it's very important to manage high blood pressure early.